Welcome, my name is Dr. Traub, and today's movie will be about using the appointment scheduler. I'm going to log in, and we will select the sample practice. Let's go directly from the main menu. We're going to go right to the scheduler. When you click on the scheduler, it defaults to the present day. Today is November 26, 2008, Wednesday. There are no appointments scheduled, and the provider shown is the first provider of schedulable providers alphabetically. We can select a different date by clicking on the Select link. We can pop up a calendar, select November 18th, and use the drop-down to select any other providers that might have been defined, which GT is the only one in there right now. So go back to the scheduler by clicking Submit, and now we're displaying Tuesday, November 18th. Let's go ahead and enter an appointment. Click on New Appointment. From the drop-down, we select a patient that we want to schedule for. Let's say Alan Jackson. Click Submit. And the first thing that happens is it shows us what payers have been defined for Alan Jackson. We can see that for the primary insurance, Blue Cross Blue Shield, there's no secondary, no tertiary, and the responsible party is Alan Jackson. We can accept those defaults and click Submit. We're now ready to schedule the appointment. Now, in the Automated Medical Assistant, scheduling an appointment is pretty much the same as entering a charge. And the advantage of doing it this way is that once all the appointments are in, not only are you entering appointments, but at the press of a button, which I'll show you later, you're actually posting all those charges as well. Now, a shortcut here is shown by the bubble help. Click this icon to pick a prior. Let me get that up there again. Prior appointment, and have all the fields fill in automatically. So if there were any prior appointments for this patient, they would show here. And we can select any one of them. They're sorted in date order, most recent first. Select one that matches what we're trying to schedule for. We'll take the first one because that'll be 90806, an individual therapy session. And notice how it fills in all the blanks. Now what we have to do is click Submit. And the appointment is scheduled. Now, if we would like to, we can print the schedule. We can show a month view of the calendar. And that's our appointment that we just entered. And now go back to the scheduler. Now, imagine a whole day, let's say 15 or 20 appointments that we entered in that fashion. At the end of the day, we simply click this button right here, Post Appointments. It tells us that it's going to convert the appointments to charges. Thus, they will then appear on the patient ledgers and will be available for billing to patients and insurance companies. It's going to update the patient totals and balances, and it's going to count down the authorizations. We'll click Yes to do that. And now it's done. This column right here, the C, stands for charge. The Y indicates that it is a charge. Yes, it is a charge. Now, if we were to go back to the main menu, remember we can just click on the Automated Medical Assistant logo up top and go to the ledger and go back to that patient, Alan Jackson. We're going to see